President-elect Biden has vowed to make important reforms to Medicaid once he takes office, with or without the help of Congress. It was the Kaiser Family Foundation that has recently compiled an issue brief of the more than 50 administrative actions the new Biden administration could take, not necessarily needing Congress, but restoring or bolstering some of the programs that exist in Medicaid, private insurance, women's health, mental health, immigrant health, and across the board. We're going to take a couple minutes today just to look at one of these topic areas, Medicaid, some of the important health reforms a Biden administration could make in Medicaid. And it starts by changing the people that head up the important agencies, Health and Human Services and the Centers for Medicare and Medicaid Services. A change in administration means new agency heads, new people that would be in charge of writing the regulations that go along with some of the executive orders and the rules that come down to help improve these Medicaid programs. It starts with enrollment, making it easier for people to enroll in Medicaid programs. So that means getting rid of some of the unnecessary administrative hoops and hurdles standing in the way of connecting with Medicaid programs. Kaiser Family Foundation suggests a Biden administration would tackle this head on. Similarly, once people are enrolled, making sure that they can actually get the coverage that they need and are entitled to. So making it and strengthening the coverage requirements and beneficiary protections. It also means finalizing some eligibility and appeals regulations, beefing up some maintenance of effort rules that are just pending at this time, and prohibiting discrimination that exists in some of the state Medicaid programs. They also want to talk about waivers. States have been requesting demonstration waivers that are authorized under Section 1115 of the Social Security Act. They're intended to improve Medicaid programs, demonstrate that you can improve a Medicaid program. Those waivers haven't been used for improvements in the last several years. Instead, they've been used to implement things like work requirements in Medicaid, or to block grant Medicaid, or even cut back on services. There are a few waivers out there to cut back on eligibility for children's screening programs called Early Periodic Screening, Diagnosis, and Treatment, EPSDT, or even non-emergency medical transportation. Some states have started reducing these services under the guise of a demonstration waiver. The Biden administration could wipe out those waiver requests and make it harder for other states to implement new changes along that line. They could also use waivers in a way to enhance benefits. Some states have toyed with the idea of expanding postpartum coverage, offering more health coverage through Medicaid to women after they have delivered a baby, extending that for a much longer period of time. A Biden administration could implement some of those postpartum waivers. Now, Medicaid-related COVID considerations are on everybody's mind, and a Biden administration could make several changes that would make it easier for people who have to respond to COVID, so states responding to COVID, states that are trying to follow state public health emergencies, or even extensions of national public health emergencies could all come from a Biden administration. There could also be adjustments to things like Medicaid prior authorizations and copay requirements during this pandemic. And once again, keeping people enrolled. Right now, a lot of states have a requirement, the maintenance of effort requirement, to keep people enrolled in Medicaid as long as the public health emergency continues. A Biden administration could make sure that that continues into the foreseeable future. In the description below, we link to that Kaiser Family Foundation issue brief. Also, the links to the other parts of this 3-part series.